Please watch this video to discover the most advanced and unique non-surgical, drug-free treatment for degenerative disc disease that could give you the relief you've been searching for. It's backed by science and success stories. This method is safe, it's effective, and it offers permanent pain relief by addressing and correcting the root causes of the degenerative disc disease. This is something that medicine, whether it's pills or injections, can never do. Degenerative disc disease can cause back stiffness, limited mobility, sciatic blade pain, overall reduced quality of life. It's not something you want to live with. And it isn't related to age. I want to reassure you of that. I'll explain more later in the video. This unique and revolutionary treatment method, which I'll describe shortly, not only helps relieve pain and address the underlying cause of degenerative disc disease, but it can also slow down its progression. This may help you age more gracefully, and in some cases, yes, it can even reverse the damage. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor here in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back and neck pain. We offer serious solutions to serious problems. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. I upload a new video every week. In addition to that, I've created a free health vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. Before I dive in, let me first explain what degenerative disc disease is. Degenerative disc disease, also known as osteoarthritis, also known as joint disease, also known as spinal decay, spinal deterioration, spinal degeneration, they all mean the exact same thing. It's a condition where the spinal discs wear down over time, leading to pain and reduced mobility. It commonly affects the neck and the lower back region. So you can see here, you've got the vertebrae, you've got what should be a nice thick disc in there. There's another vertebrae, there'll be another disc, another vertebrae. You can see the yellow guys coming off here. Those are the nerves. They come right off your spinal cord. That goes up to the brain, and that's how your brain controls everything that's going on in the body. That's what we want to see throughout the spine. Contrary to popular belief, or what you may have been told by your doctor, this condition is not caused by the natural aging process. Think about this for a moment. Let's say you're 55 years old. Let's say your x-ray report shows that you've got degenerative disc disease at L4-5, but at L3-4 it's not. What's the age of that L4-5 disc and what's the age of that L3-4 disc? How is that possible that one's degenerated, one isn't, if they're the exact same age and it's aging that's actually caused that? And you're going to see, as I continue, you'll find out exactly why it doesn't have to be age-related. It's what we do or what we don't do over that time. Now, unfortunately, you were told it's all inevitable with aging, and as long as you listen to that, it becomes a self-fulfilling prophecy. You've been misinformed, right? It's not your fault. You're going to learn something different today. Now, the most common cause is abnormal spinal misalignment. Now, some people refer to this scientifically also as what we call a vertebral subluxation. But again, what we want is we want that vertebrae, that disc, another vertebrae. Spinal misalignments are segments of the spinal bones, of the vertebrae, that have shifted away from their normal position. So sometimes this happens locally at maybe one or two vertebrae. Sometimes it can happen globally throughout the entire spine or through certainly a number of different vertebrae. So when you do that, if you get that misalignment, right, where the vertebrae are no longer aligned properly, if that starts to jam up, if it starts to jam, we start to put pressure on that disc. We start to shift the weight of that vertebrae over that disc. When you get that load of that weight on the disc being shifted more to one side, it results in more pressure being built up on that side of the disc. Over time, that disc compression increases, it dries out, and the spinal bones above it and below it actually then have to compensate. They have to develop what we call spurs or osteophytes. So what happens is first that disc starts to wear out, wears and tears. When that happens, right, the body will actually create bone spurs. These are spurs or osteophytes, and it's attempting to try to fuse the vertebrae together because it's A, it's adapting to that increased pressure, and B, if it fuses together and stops that movement, then you will not, the goal is trying to make the best of a bad situation, is trying to stop you from putting even more pressure on that nerve. But unfortunately, it's like one bad situation becoming worse and worse, creating another bad situation. Now add 10, 15, 20 years to that, and you can see how it's a recipe for spinal disaster. If untreated, degenerative disc disease will progress, right? Almost guaranteed to progress. It leads to increased pain, further mobility issues, and possibly permanent disability. Now, hopefully you can see why medicines can never correct the cause of disc degeneration. They can't stop that progression. If there's excess pressure on those discs from spinal misalignment, there's no pill that's going to stop that. Unfortunately, I understand that relief of pain is important, but it's not stopping the progression, which then just means that you're going to be in a lifetime of pain medications to deal with the pain and never getting to the underlying cause of the problem. If we don't target the root cause, medications are going to provide temporary relief rather than a long-term solution. Now, wouldn't you rather work on correcting the underlying causes of the disc degeneration in the first place? That's why it's crucial to discover and correct all of those causes of your degenerative disc disease. Doing so can provide permanent pain relief, prevent progression, and potentially avoid surgery. That's exactly what we do in my health center in Ottawa, Ontario. Number one, we need an exam. That exam needs to be thorough, getting at all of the underlying causes of the problem. If you don't know all of the causes, how on earth do you ever fix it? Number two, we're going to look at all the causes that are actually then putting that excess pressure, causing that spinal misalignment, what's actually aggravated that degenerative disc disease and allowing it to progress. That could be posture, that could be your workstations, that could be so many other things in your history, that could be previous injuries and accidents and so forth. We're also going to do something called Neuro-Spinal Correction. So again, if there's misalignment, we're going to restore that misalignment. We're going to get into nutraceuticals. This is something that a lot of clinics don't really understand that well. The body's capable of producing these nutrients. It stops doing that about age 40. So unless you're getting the target nutrients to actually start to rebuild that disc, you're never going to restore this back the way it should be. We're going to get into something called Neuromuscular Re-Education. So this goes way beyond exercise. A lot of people think a core exercise is magically going to fix everything in the lower back. I've dealt with some of the world's best athletes. I'm a big fan of exercise, but putting more pressure on something that's already jammed or wearing out is not going to fix it. It's like driving your car more on misaligned wheels. You'll get away with it for a while, but eventually it's just going to wear those wheels out faster. And the number one thing that we do in our center is something very specialized called non-surgical robotic laser spinal decompression. It gets to the root cause of your degenerative disc disease, and it's tailored treatment specific to what we find on your x-rays, in your exam, on any MRI. What it is if you have all that buildup of pressure on those discs, what on earth makes more sense than to take that pressure off the disc? Now, you're not going to get this from basic traction or inversion tables. I have an inversion table in my home gym. I love it. It's going to stretch that area. That's why a lot of traction tables actually fail at this. Even standard spinal decompression can fail at this, because what happens is even when we try to get that decompression in there, what we're getting, you may have that for 10, 15, 20 years. The body's going to resist against you. That is what is so unique about non-surgical robotic laser spinal decompression. We have the only system in Ottawa. This is a patented system. There are only 12 of these worldwide, and it came from a very smart doctor who said, look, why are we not getting the results that we want just through spinal decompression? So true spinal decompression literally will create a decompressive effect. And people misuse that term all the time. Just pulling something apart doesn't necessarily cause decompression. To create a decompressive effect, you literally are going to create a vacuum effect that draws fluids and nutrients back into the disc. It actually rehydrates the disc. So understand that disc has dried out over all those years of that degenerative disc disease as well. You need to rehydrate that disc. And in doing so, you actually finally start to heal that disc back to the way it should be. But again, a lot of standard spinal decompression still doesn't do that, because it's going to resist that movement. So for the first time ever, we've combined it with Class 4 laser. So Class 4 laser is the highest level of laser that is approved by Health Canada and the FDA. And in this unique patented system, you get this simultaneously. So coming from underneath the system is that Class 4 laser. Class 4 laser has been around for 20, 30 years, hundreds of scientific studies. Same thing with true spinal decompression, hundreds of scientific studies. Spinal decompression was actually invented by a doctor by the name of Dr. Alan Dyer, MD, PhD, former Minister of Health for Ontario, so very much a Canadian thing. And by combining the two, what the Class 4 laser is going to do is it does a number of things, but really two key things. Number one, it's going to ease up all those muscles so that when we do that spinal decompression to you, your body's not going to resist. It's not going to fight against it. We're actually going to achieve true spinal decompression and get that pressure off that disc, allow those nutrients to come back in, allow that disc to be rehydrated. And number two, you've done damage in that area. Class 4 laser is going to help to heal that damage. Everything from increasing blood flow to decreasing toxins to speeding up healing to all of these things from the Class 4 laser. Right? We've seen this happen in our center many, many, many times. I think of Adrian, a 65-year-old man. His degenerative disc disease was so bad, couldn't even put his socks back on, was off work for 9 years. And again, unfortunately, most of society looks at cases like this and says, oh, well, just suck it up, just keep trying to push through. Oh, just go strengthen your core. Here, take another pill and so forth. This was causing serious issues for his mobility, for his function, being off work for that many years. His mental health has been affected as well. Guess what? We've literally increased the disc height back in Adrian's discs. He is now back doing the things that he wants to do. I think of Dan. Dan was a search and rescue specialist. So this would be the guy who, if you were trapped underwater, he'd be putting on a scuba gear to rescue you. If you were the person, who skied off the slope somewhere in the middle of nowhere, he'd be the one rescuing you. This is a guy that I don't want to be in back pain. I don't want this guy to have to deal with degenerative disc disease. He's gone from an 8 out of 10 down to a 1 out of 10 in his pain levels, all by taking the pressure off that area, restoring nutrients to come back into the disc, allowing that disc to be rehydrated as well. All this is possible with non-surgical robotic laser spinal decompression, and we can actually show this to you on pre and post x-ray. I hope you now have a better understanding of degenerative disc disease, its true cause, and realize that if you've been diagnosed with this condition, it's not a lost cause. Doing nothing is the only thing that will make this inevitable, that it will continue. There are non-surgical, effective and safe treatment options that address the root cause of degenerative disc disease, like non-surgical robotic laser spinal decompression. Now, I want to hear from you. What treatment methods have you tried for degenerative disc disease? What's worked for you? What's not worked for you? Please leave a comment and let me know. Please share your story. If you found value in this video, go ahead and like it and share it now so we can help more people suffering from degenerative disc disease. It also helps YouTube deliver my message and the solution to more and more people. Be sure to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. Now, the next video you should watch is this one right here. The 5 best exercises for degenerative disc disease. If you want to relieve your back pain and stiffness, please go watch this video right here, right now.